Hello everyone. Welcome to day 2 of Windstroke, brought to you by Lamp AccuWellness Foundation Inc. as part of its continuing LAMP lecture series. The aim of the webinar is to provide an overview of what strokes are and why they occur. You will learn about stroke causes, symptoms, treatment and recovery, and preventative measures, as well as what to do if you encounter someone on or offshore who is having a stroke. Our learning objective for today is Etiology and Pathology of Windstroke. The etiology of windstroke is very complex because this condition, although it occurs suddenly, brews up over many years, and there are 4 main etiological factors: overwork and emotional stress. Working long hours under stressful conditions without adequate rest, together with emotional strain, leads to deficiency of kidney yin. A combination of these 2 factors is the most common cause of kidney yin deficiency in industrialized societies. Kidney yin deficiency is brought about by old age, long-term consumption of a diet that depletes the yin, late stage of febrile disease, dehydration, and if you're on medications that consume the yin. And we all know that if one has kidney yin deficiency, this almost always leads to liver yin deficiency, which can bring about the following. Empty fire will give you bone steaming, fever in the afternoon, evening and night, warm palms and soles. Yin may be too weak to nourish the body, leading to dry mouth, dry skin, blurred vision, emaciation, or one may lose consciousness. Yin being too weak to nourish the tendons will lead to trembling fingers, muscular spasms, and rigid extremities. Kidney yin deficiency often leads to deficiency of liver yin and the rising of liver yang. Liver yang, especially in the elderly, often gives rise to liver wind, and liver wind causes apoplexy, possibly coma, mental cloudiness, and paralysis. There is also an interaction between internal and external wind, as the external wind may actually stir up the internal wind. Eating irregularly, eating excessive amounts of fats, dairy foods, greasy, fried foods, and sugar weakens the spleen and leads to phlegm. And phlegm predisposes to obesity. Phlegm will bring about numbness in the limbs, mental cloudiness, slurred speech, or aphasia, and the tongue will be swollen with sticky coating. Physical overwork, including excessive exercise and sports, also weakens the spleen and may lead to spleen deficiency, which in turn may lead to phlegm. Excessive sexual activity in men, combined with inadequate rest, weakens the kidney essence and leads to marrow deficiency. If the marrow fails to nourish blood, eventually this may lead to stasis of blood. And blood stasis causes stiffness and pain in the limbs and a purple tongue. Physical overwork, and this includes excessive lifting or Excessive exercise and sport activities weakens the spleen, the muscles, and the channels. And deficient spleen fails to produce enough blood, leading to blood deficiency in the channels. A pre-existing internal wind exploits the deficiency of qi and blood in the channels to penetrate them. Exposure to external wind interacts with the internal wind in the channels, and this leads to paralysis of the limbs. So let us try to summarize the etiology. So as you can see, we have inadequate rest combined with emotional stress and excessive sex. This will lead to kidney yin deficiency, not nourishing the liver yin, leading to liver yang rising and liver wind. Therefore, this will be manifested as apoplexy, coma, mental cloudiness, and paralysis. Another etiological factor would be irregular diet with physical overwork. This will definitely lead to spleen deficiency, and we all know that spleen yang is closely related to kidney yang. So you will have spleen and kidney yang deficiency leading to phlegm fire. And therefore, one will have numbness in the limbs, mental cloudiness, aphasia, sticky yellow tongue coating. Another etiological factor would be excessive sex with inadequate rest. This will lead to kidney deficiency, and kidney deficiency will result in marrow deficiency. Marrow deficiency will be unable to nourish the blood, leading to blood deficiency, and with blood deficiency comes blood stasis. Therefore, you have a patient presenting with stiffness and pain in the limbs. Physical overwork with inadequate rest will lead to weakness of the channels, and this will the internal wind in the channels will be stirred up by the external wind. So there will be wind in the channels leading to paralysis. So from the manifestations, the clinical manifestations, one can actually deduce the etiological factor. Now let's go to pathology. These are the four main pathogenic factors involved in the pathogenesis of wind stroke. They may not all be present, but there must usually be at least 3 of them to cause wind stroke. They may be present in different degrees of intensity, giving rise to many different types of wind stroke. Wind. Wind causes the sudden loss of consciousness of an acute attack of wind stroke and the subsequent hemiplegia. Wind must not be taken literally as what we feel in the natural environment. In TCM, there is external wind and internal wind. It is believed that wind causes the sudden loss of self-awareness in an acute stroke attack and its subsequent hemiplegia. Liver yang is formed as a result of severe liver and kidney yin deficiency. This liver yang will subsequently induce liver wind. So this is the internal wind, which is a causative agent of stroke, coma, mental clouding, and paralysis. Internal and external wind can interact because the second can shape the first. The external wind can shape the internal wind. To quell the formation of internal wind, it is important to recognize there are different types of internal wind which must be differentiated and dealt with accordingly in clinical practice. The most pertinent categories of differentiation of internal wind theory are heat, phlegm, and qi deficiency. Phlegm contributes to causing the sudden loss of consciousness of acute wind stroke. In the channels, phlegm causes numbness or tingling of the limbs. Tingling or numbness after stroke is a common secondary effect that causes loss of sensation in some of the affected areas. It can be accompanied by other sensory issues such as tingling sensations and even hypersensitivity. For some people, post-stroke numbness goes away on its own through the phenomenon of spontaneous recovery. Phlegm is such a fascinating topic in traditional Chinese medicine. There is much more to it than meets the eye. While phlegm may be quite a straightforward concept to most, it takes on a different meaning when discussed as a pathological factor in TCM diagnosis. Phlegm can be considered to be visible, or substantial, or invisible. We may see it, we may not, but it can be the underlying factor in many diseases in TCM. The visible kind is easy and doesn't require much of an introduction. It is exactly what you think it is. It runs or gets stuck in your nose, throat, head, chest. It has multiple possible color possibilities: clear, white, yellow, green, orange, red. It can be thick or thin, but whatever its form, it's definitely annoying. This is the phlegm that are involved with flu, coughs, colds, bronchitis, rhinitis, pneumonia, etc. Invisible phlegm can be found anywhere in the body. In the head, it can lead to dizziness, vertigo, dulling of the senses, deafness, confusion, forgetfulness, brain fog, headaches, convulsions. Related diseases may be Alzheimer's, dementia, Meniere's, stroke, epilepsy, insomnia, depression, schizophrenia, and a myriad of other mental health disorders. Phlegm is mainly produced by a challenged digestive system. This is the spleen in TCM. It can either be because the spleen is inherently weak or because we bombard it with too many heavy dietary factors: dairy, wheat, sugar, overconsumption of cold or raw food, and deep fried, greasy food being the largest culprits. The lungs and kidneys can also contribute to the formation of phlegm if they do not do their part in the distribution and excretion of body fluids. Phlegm is exactly like its nature, sticky, and therefore can be difficult to treat. The best thing, but probably the most challenging thing you can do for yourself if you have a phlegm condition, is to start with your diet. Limit your consumption, or better yet, completely eliminate those troublesome foods mentioned. TCM treatment, such as acupuncture and cupping, can diagnose and assist with and accelerate the elimination of phlegm over time. Overall, in general health, combating phlegm will leave you feeling clearer, lighter, happier, and healthier, as viruses and bacteria are far less likely to stick around if there is not anything for them to stick to. When obstructing the orifices, phlegm causes aphasia or slurred speech. What is aphasia? Aphasia is a language disorder caused by damage in a specific area of the brain that controls language, expression, and comprehension. Aphasia leaves a person unable to communicate effectively with others. Many people have aphasia as a result of stroke. So here are the characteristics of aphasia. Poor listening comprehension, reading comprehension, writing expression, verbal expression. So let's define aphasia. Okay, it is a multimodality reduction in the capacity to decode and encode meaningful linguistic elements. And according to Kurtash, aphasia is an acquired loss of language due to cerebral damage characterized by errors in speech, inspired comprehension, and word-finding difficulties. And finally, aphasia has arisen by brain damage, which causes language disorders. So it is associated with amounts of deficits in language comprehension and production. Fire injures yin. This fails to nourish the sinews and channels and leads to malnourishment of the channels, contributing to hemiplegia. Both ischemic and hemorrhagic stroke pertain to the category of wind stroke in Chinese medicine. Up to date, it is deemed that the etiology and pathogenesis of wind stroke are wind, fire, phlegm, qi, stasis, and deficiency. Among them, it is regarded that wind and fire are the key factors triggering wind stroke. By analyzing the time order and causality, it is found that wind stroke is prior to the onset of wind and fire. Wind and fire are the secondary outcomes of wind stroke. By parallel comparing stroke with thromboembolism and hemorrhagic diseases in other ZAM organs, it can be understood that the reason why wind symptoms appear in stroke is due to its physiological feature of the brain itself. Blood stasis affects the channels and the joints. This causes the rigidity and pain of the limbs seen in the sequelae stage of wind stroke. These are the pathogenic factors appearing in wind stroke: wind, phlegm, fire, and stasis. Besides this, there will also be some deficiency of qi, blood, or yin, especially kidney and or liver yin. Tongue appearance is an important indicator in the prevention of wind stroke. Now let's talk about the preventative value of tongue diagnosis in the elderly. So if you see a deviated, moving, stiff tongue, that is internal wind. Red tongue without coating is severe Yin deficiency with empty heat. A swollen tongue body with sticky coating is phlegm, while a purple, stiff tongue is blood stasis. So now you could see the different pathologies involved in wind stroke. The value of tongue diagnosis in wind stroke lies in its preventive role. If an elderly person's tongue presents an appearance as in this table, it strongly indicates at least the possibility of wind stroke. For example, the tongue may be reddish purple, stiff and swollen, indicating fire, stasis, wind, and phlegm, the four pathogenic factors of wind stroke. Thank you very much for your attention.